My name is Lori Khatchaturian, and today I will be presenting on the implementation of prosthetics in developing countries. First and foremost, I would like to introduce myself. I am an upcoming senior at La Cañada High School and live in Los Angeles, California. One thing I am very passionate about is medicine. I am an intern at the La Cañada High School Children's Hospital of Los Angeles sports medicine team, and am a Children's Hospital of Los Angeles junior ambassador. I also won 5th place for the AACI National Sports Medicine Competition. Another thing I am passionate about is the environment. I am currently the founder and chairperson of the La Cañada High School Sustainability Project and am a member of the Principal's Campus Beautification Committee. Finally, I am very passionate about theater. I am a current member of the La Cañada Playhouse and will be in the Alex Theater's production of Shakespeareans this upcoming year. I am also currently a teacher at summer acting camp. In the future, I hope to study the intersection between the environment and medicine. I am an Armenian American, and for those of you who don't know, in 2020, Armenia underwent the 2020 Second Nagorno-Karabakh War with the nation of Azerbaijan. Currently, the two nations are involved in a border crisis. Throughout this war, many soldiers have become amputees, losing multiple limbs. However, Armenia is a developing country, and many soldiers, being as young as they are, do not have access and cannot pay for advanced prosthetics made in the West. Soldiers are forced to live with a poor quality of life, feeling depressed and anxious, unable to do the things they once loved for the rest of their lives. Learning about this problem in my native country of Armenia led me to research the implementation of prosthetic limbs in developing countries throughout the globe. What I discovered shocked me. Prosthetic limbs cost from a range of $5,000 to $50,000 and only survive 3 to 5 years, making them extremely expensive. Even though roughly 30 million people require prosthetic devices, 75% of developing countries do not have any opportunities for prosthetic limbs. In developing countries, prosthetics are generally unavailable, unaffordable, and rehabilitation programs rarely exist. Therefore, amputees are stuck with a poor quality of life. In order to find possible solutions for this issue, I decided to conduct independent research in Armenia, hoping to connect what I found with developing countries throughout the globe. My primary research question was, how can prosthetics be implemented in developing countries? Through conducting multiple interviews, I was able to discover 3 main problems stopping developing countries from gaining access to prosthetics. The first is cost. As mentioned before, prosthetics cost a range of $5,000 to $50,000 and need to be replaced frequently, making it very difficult for amputees to purchase. Secondly, there is a lack of trained professionals that can insert and teach amputees how to use prosthetics. In an interview with Arthur Zenian, the founder and CEO of NBio, where he described his medical mission to Armenia with Glendale Adventist Hospital, he stated, "There is a lack of professionals that can effectively use the medical equipment after we leave Armenia." Finally, the third problem is the lack of rehab centers and aftercare. As stated by Arthur Zenian, gaining access to prosthetics isn't enough. Aftercare is equally, if not more, important. After more research and an interview with Azatui Garaglanyan, the executive director of Armenia Fund, I found that nonprofit organizations or charities may be one effective solution. One way Armenia was able to supply amputees with prosthetic limbs was through Armenia Fund, a nonprofit organization that spent over $3 million for all prosthetics and became the largest contributor for rehabilitation centers in Armenia by creating the rehab center Zimvoritun. Through donations, Zimvoritun was able to fly in experts from New Zealand that would provide prosthetic limbs, teach Armenian professionals how to insert the prosthetics, and teach amputees how to use prosthetics. This organization was able to provide prosthetic limbs free of charge, train physicians on how to use and insert prosthetics, and provide rehab centers for amputees to learn how to use their prosthetics, eliminating all 3 major problems that developing nations face when trying to implement prosthetics. Another example of this is the Glendale Adventist Hospital medical mission, where Arthur Zenian and his colleagues were able to provide and train Armenian physicians on how to operate medical equipment that could save lives during the war. Thus, one of the largest contributors to prosthetic availability in developing countries such as Armenia is nonprofit organizations. I will be continuing my research on this topic during the week of July 17th, where I will be visiting the Armenian Heroes Rehab Center, a center built by the nonprofit organization Armenian Wounded Heroes, which is located in Armenia. I will be conducting interviews with professionals and soldier amputees in hopes of furthering my research. Now, of course, charities or nonprofits cannot assist every single person in developing countries. Because prosthetics are so expensive, they would need to raise millions of dollars to assist everybody, which isn't practical. Therefore, I decided to research on cheaper ways to manufacture prosthetics so that amputees could purchase them themselves. And one way I found was through 3D printing. 3D printers use a computer-aided design program to apply layers of material to create a highly precise finished part. The light curable elastomers provide a good balance of flexibility and strength. And to top it all off, this is all done in a short amount of time at low cost. A 3D printed arm can cost $395 and be produced in one day. The 3D printing of prosthetics has been in experimentation for a while, and most results prove it is much cheaper than traditional methods of manufacturing prosthetics. For instance, Lorenzo Spreofiso, a student at the University of Leeds, used 3D printing to create a prosthetic arm with vibro-tactile feedback, and it costs under 3,500 euros. Now back to the initial research question. How can prosthetics be implemented in developing countries? One way is through 3D printing, a method that is able to produce prosthetics at a cheaper and faster rate so that amputees could purchase them. Nonprofit organizations or charities could also provide the prosthetics and then provide aftercare by creating rehab centers or training physicians and the amputees on how to use the prosthetics. If prosthetics can be effectively implemented in developing countries, all people with missing limbs across the globe will be able to perform actions that were once challenging effortlessly. War-torn countries such as Afghanistan, Iraq, Syria, Ukraine, and Yemen will have access to prosthetics for a large amount of their soldiers with missing limbs. This ability for amputees to access inexpensive products across the globe will have a significant impact on impoverished countries. These are my references. I would like to thank my parents, Arthur Zenian, Azadui Garaglanyan, Chris Petrosian, and the Global Health Leadership Conference at Johns Hopkins University for giving me the opportunity to speak today. And thank you everyone for watching. I hope you all have a great day.